Okay, this is my reflective reading journal number 6. The first question is components of a mental status exam, the 5 dimensions and how I would observe or inquire with my clients about each of these. These are actually something I do routinely on a day-to-day basis with my clients. The first one with appearance, this could be what they're wearing, how they're dressed, what their grooming and hygiene is. Do they have an odor? Is their hair disheveled? Is this normal or abnormal for them? The next one could be mood. Mood can be either vocalized by the client. It could also be shown in their body language and their posture, their tone of voice. So you could see if their moods may be more irritable one day, if they're short-tempered with you, or if maybe they're in an elevated mood and they're talking really fast and they're very happy and excited. The other one is orientation. This is their ability to respond. Are they here and now with you? Are they trapped in maybe a hallucination? Or are they trapped in a traumatic event in their life? Or are they present in the here and now? Another one is suicidality. And suicide ideation is really just important to ask directly. Be as direct as you can. There's also things you can pick up on, such as is there talk of not having aspirations for the future in terms of comments like, oh, well, I'm not going to be around to see that, or yeah, I don't really plan on being there. Those kinds of comments, and just a overall hopelessness and lack of motivation for what's to come. The fifth one is attention span, and this is something that can be observed and asked. Are they able to engage in conversation and stay on track and to answer questions directly? That can tell you where their attention span is. Are they getting bored more easily? And it can also be something you can ask about. Is this something that's affecting them? Are they noticing this in their day-to-day life? Questions like that. For the question about how comfortable I am discussing suicide with a client, on a scale of 1 to 10, I would say I'm a 10. Maybe sometimes a 9. But I actually do this for a living. My people and my clients that I see are chronically suicidal, which means that they are always at a place of being suicidal. And I'm frequently having discussions with them on a day-to-day basis about what that means for them today and if they are safe today. In terms of conducting a risk assessment, I think there are many different ways to do it. For me and my people, it's all about the acuity and the level of desire. So is this something that is happening right now? Here in this moment, are you thinking, yes, I want to die? Then we go on with a conversation of maybe this might be a crisis situation. Then we can move into looking into maybe a safety plan or a psychiatric hospitalization, what's best suited to keep someone safe in that moment. And then also assessing for their level of desire. So with the people that I treat, they may chronically be suicidal, but that does not necessarily mean that they want to die here and right now. They may be thinking of instances where maybe in a couple of years, I don't really want to be here. Okay, we can work with that because that doesn't mean right now that you're in any immediate danger. That just means you're not too optimistic about the future. In terms of being comfortable with it and things that you can do to become more comfortable with it is being open with the conversation, learning and identifying your own triggers. So there may be certain levels of witnessing things that may be too much for somebody. So I have witnessed people overdose. I have witnessed people self-harm by cutting themselves right in front of me, and those are things that were very difficult to be a part of, and there are things now that I'm aware could be more of a trigger than other things, but it's really understanding yourself and what may be too much for you. When identifying each risk factor with the IS path form, we've got suicidal ideation, S is substance abuse. P is purposefulness. A is anger. T is trapped. H is hopelessness. W is withdrawing. A is anxiety. R is recklessness. M is mood change. In terms of a mental disorder being defined as a condition with 3 elements, according to the textbook, the first one is a clinically significant disturbance in an individual's cognition, emotion, regulation, or behavior that reflects a dysfunction in the psychological, biological, or developmental process underlying mental functioning. The second one is significant distress or disability in social, occupational, or other important activities. Must not be merely an expectable or culturally approved response in a common stressor or loss. And then 3 is the disorder must not be primarily a result of social deviance or conflicts with society. And those can all be found in our textbook. And that is my discussion.